in Serbia, they opened up the whole country. Like about 2 months ago when we got here the day the country was opened, and the president here said, there's no coronavirus, everyone go about your business. But it turned out, I guess, that part of that was because elections were coming up. So there was 3 weeks, stadiums were open, there was a soccer game with 40,000 people. Anyway, so 3 weeks into it, elections end, and they go, oh, there's coronavirus everywhere. We're shutting down the country again, and there were riots. And so we all went into quarantine, and my husband, my baby, and I actually went into the clinic my dad was in on recommendations from his doctor, saying just hunker down here for a few weeks until this is over. And so we all got tested when we went in. We were all negative. 10 days into quarantine, we all get symptoms. And it was everybody in the hospital got it. And it was not that big a deal for my husband and I and my baby, but it ended up affecting both of my dad's lungs. So this is the second time he got pneumonia this year. He got it in the Russian hospital, now he got it in the Serbian hospital. And he was put on a whole bunch of, kind of preemptively, he was put on antivirals and things. And I'm not sure, to tell you the truth, if that was necessary, because his symptoms weren't that bad. He didn't have a cough, he had a mild fever, but they just put him on everything. And so we've had a step back in his recovery, because one of the antibiotics they used actually doesn't work well with people in benzodiazepine withdrawal. It's called a fluoroquinolone. And about 5 days into the treatment, I realized what they were using and was like, please stop using that antibiotic. That's toxic for people in benzodiazepine withdrawal. And the only reason I knew that was because some doctor had told me about it in February, was like, just beware, don't put them on fluoroquinolones, because nobody really knows that. So anyway, life has just been, it's not good. Things are not good right now. He'll get better, but he's definitely taken a step back, and it's just really unfortunate. At least the coronavirus we're all on the tail end of the coronavirus, so we're immune. So I guess that's the good part. But yeah, it's been a disaster. It's funny. I put out this YouTube video 2 months ago complaining about the country being shut down and what I thought was a terrible decision for shutting down the country over the coronavirus, because of all the implications that shutting down a country has. I put that video out, and then I got coronavirus, and I was like, oh no, I hope nothing terrible happens, or that's going to age really badly. But it hasn't been that bad. I was really convinced it wasn't coronavirus for the first 14 days, because I've had pneumonia a number of times, so I feel like I'm kind of susceptible to pneumonia, and it never got into my lungs. It was like a flu. So I was nauseous. My face was kind of puffy. I was sore, and I had a very mild fever of 37.5, mild 3 times. It just kind of kept coming up, and my nose has been stuffy, but it's really just been a cold. It's been a long cold. So it's been 17 days of off and on symptoms, but I didn't think it was coronavirus until the test came back positive. It just came back positive yesterday. I was like, it's just a cold. My nose is a bit stuffy. I haven't even been tired enough to move things around really. So it hasn't been that big a deal.
So I have to ask also, so obviously coronavirus apart, and having pneumonia for your dad must be just an awful experience. Is his, or maybe you don't know this because of the coronavirus, but is his recovery from the benzos still okay? I mean, you did a podcast, I don't know when it was, a few weeks ago, where it seemed that he was getting better. So in that specific kind of arena of the benzos, is that still on the right track?
He's not in as good shape as he was when we did that podcast. I think it's because he had this coronavirus fluoroquinolone treatment, and there's definitely toxicity involved in that. Fluoroquinolone is a GABA antagonist, so it does exactly the opposite of what a benzodiazepine does. So if you're already in withdrawal that way, it can be harmful. So he's worse off than he was a month ago, but he's still, I mean, it's just a process. Hopefully in a few weeks, we'll be able to put out another podcast saying, hey, everything's okay again, but he's definitely having a rough time right now.
Absolutely, and we all wish him well. Over the last year, you must have received, I don't know, I'm just guessing here, a lot of messages of, good wishes and things like that. Have you been overwhelmed with messages from fans and people who's read his book and things like that?
Yeah, I mean, we get messages. We get hundreds of messages all the time, and a lot of people who've gone through, like an unfortunate number of messages from people who've gone through a similar benzodiazepine withdrawal or some sort of other pharmaceutical withdrawal. So I get a lot of, this is what you should do, this is what I did to fix it, which is, I mean, that's the only reason I knew about the fluoroquinolones. But yeah, it's been overwhelming. And even though it's kind of a touchy subject, like we didn't know how people were going to respond to a drug dependency, but we wanted to talk about it anyway. It's still been overwhelmingly positive. Even people who weren't fans of him have reached out and said, I really hope he's doing okay.